does someone protect their thyroid?
Thyroid is this wonderful gland in your neck that gets signals from the brain to create thyroid hormone. Thyroid hormone regulates so much of our metabolism and keeps us warm and keeps us at an optimal weight. And it is subject to external influences. I worked in a cardiac catheterization lab for 30 years, and radiation can affect your thyroid, and other people are exposed in similar ways, so I always wore a thyroid collar to protect it made of lead. Just a personal anecdote. But most of it is the concern of external sources. So there's autoimmune thyroid disease, where you actually can develop excessive thyroid hormone, deficient thyroid hormone, and you can measure antibodies. I mean, you don't want your body to be attacking your own organs. You don't want your body to be attacking your own thyroid. We're not completely sure where that comes about. There's a lot of interest in gut health, gut damage. Plant whole food diets are very gut healthy. They're low in saturated fat, which injures your gut. They're low in processed foods, sugar, alcohol, which can damage your gut. You got to be a little concerned about pesticides and Roundup and glyphosate, and we're all exposed to it, which is why some organic choices, the dirty dozen, may make some sense. So that may be a source of why we attack our thyroid. There's a very thin thread that in a few people, antibodies from gluten and grain substances may cross-react with the thyroid. That's not a well-developed science. And in reality, we don't know for sure, but it's always a good idea to respect your GI tract and try to eat and treat your GI tract the healthiest with the highest quality foods and highest quality sources of drink and such. There's been an abuse in the literature that cruciferous vegetables, kale, bok choy, Brussels sprouts, cauliflower, are dangerous to your thyroid. Kale is awful for your thyroid because there is a chemical class called goitrogens, goiter, that may exist in cruciferous vegetables. So as far as I'm aware, there's one single case report in the literature of a woman who ate about 4 pounds of bok choy a day in the Asian area and developed severe low thyroid, and when she stopped eating 4 pounds of bok choy a day, it resolved. So I would certainly advise people a variety of fruits, vegetables, whole grains, and legumes. No single source in excess. That's a very odd diet, obviously. But in general, these are, there's data, we mentioned the Adventist health study, lower rates of thyroid disease in the Adventists that ate plant diets. So that's what I'd recommend, and it's really not a very common disorder.
Do you eat a 100% plant-based diet? And if so, how long have you been?
Yeah, I do eat a 100% plant diet, and it's been for a very long time, and fortunately it wasn't for a health crisis. It actually was an accident of life. I walked into the dormitory in undergraduate in 1977, University of Michigan. Was offended by the food. It was nothing like Mama used to make, but they had a great salad bar. And I was with my girlfriend, now my wife of many decades, and we both responded with the idea that that's the only thing that looked decent. It was just this great salad bar, and I'm very grateful for really that first week in the dormitory, because I never went back. That's the last time I ate animal products was 1977, before my maize and blue years. And I didn't know what to call it. I was a salad baritarian. I was a plantitarian. Of course, I was quickly in medical school and heard little snippets about nutrition and diet, not much. But read John Robbins' book, A Diet for a New America, learned of Dr. Dean Ornish and his research, and realized that this kind of accident in our diet in our family was actually a very heart healthy and actually a therapeutic diet. So it was just a great twist of fate, so that I was available to teach patients right from the beginning of my career that food is medicine, food is a therapy. It's not just drugs, not just surgery, not just stents, not just chemotherapy and radiation in other fields. It was food, 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 it's the food.
What advice do you have from all the research you've done on the best way to deal with memory issues and memory loss?
Can you repeat the question?
Sure.
I'm just joking with you. All right, a little levity. Memory loss. Many factors, many unknowns, but we've made a lot of progress. And progress, for example, there's a study in Chicago going back 20 years, the Chicago Healthy Aging Project, that looked at diet, lifestyle, followed people, and particularly looked at aging and memory issues. And the consensus out of those research studies is very similar to heart data: whole grains, naturally low saturated fat food choices, which are fruits and vegetables and legumes, beans, peas, lentils. You definitely want to throw in some fitness, some exercise, some walking, some motion. You might concentrate on a few foods in general. Blueberries have the reputation of being extremely brain friendly. Some people call them brain berries. Leafy greens are incredibly good for the brain, providing sources of anti-inflammatory diet. And you talk about spices like turmeric, like rosemary. Rosemary was called by Shakespeare 500 years ago a great choice for your memory, and there actually are studies now that support that. There's a very cool village in Italy called Acciaroli. It's south in Naples. I visited it about 2-3 years ago. And Acciaroli has this reputation of being a longevity pocket. It's a city of 3,000, not designated a blue zone, but pretty close to Sardinia across the water. And anyways, they are rosemary freaks by just habit in Acciaroli. And this has been studied by a scientist from San Diego, a cardiologist from San Diego, that one reason health blossoms so much in Acciaroli, I would say because you're on the Mediterranean and you're living one of the prettiest areas in the world, but rosemary is part of it. So those are the keys. We also know optimal weight. And in general, Adventist Health Studies and others say people that eat 100% whole plant diets generally have a lower body weight, have less issues with overweight and obesity. There's something called the dinosaur syndrome. The bigger your body, the smaller your brain. And that's been substantiated by many studies, including one just recently. So if you can keep your weight more optimal, it's going to lower your risk of heart disease, it's going to lower your risk of type 2 diabetes, it's going to actually promote longevity, but it's going to promote optimal brain size, brain function, brain health. So it's plants again. They are always there to support the health of every organ system in the body.